So, it is important to know how much time you have for your interviews, especially in MMIs, as they will help you structure your answer and time your answers accordingly. You're usually given the timing for your interview in advance, which will help you prepare. For panel interview, which usually lasts around 20 to 30 minutes, but it can be shorter if the interviews are running late. So prepare for the worst case scenario. If you have a choice, I would recommend booking your interview in the morning and get your interview out of the way. Interviewers tend to get more tired as they get on with the rest of the day. Just imagine how many interviews they will need to do in one day, especially if it's an MMI. They might get bored and sick of hearing the same or similar answers to questions. The timing for panel interviews is different and it's less structured when compared to MMIs. The timing and style for panel interviews are very dependent on the interviewers. They're more likely to ask follow-up questions, it's more likely to be conversational rather than questions and then answer in an MMI. They will often direct you into answering what they're looking for or helping you reach an answer to maximize your points. Some interviewers are stricter and less friendly than others. Some might be told to be specifically less friendly to assess how you would respond, i.e., playing the good cop versus bad cop. You should always be prepared for this situation and ready to be challenged and give good explanations and reasoning while not panicking. So nowadays, more medical schools are using the multiple mini interviews as a way to assess applicants for interview. They are good in a way as they can go through a lot of applicants in one go, but it also helps standardise the way they assess each interviewee. In MMI, it's divided into multiple stations, and each station will usually assess one specific type of criteria, such as communication, empathy, motivation for medicine, etc. They can be in the form of, i.e., a traditional question and answer discussion, perform a task, role playing, etc. They may or may not be allowed to ask any follow-up questions, but usually they provide the information you need to know prior to the interview, i.e. how many stations in total and how many minutes per station. They may not provide you the interview criteria. If not, it will be worthwhile to look at their website, ask them directly, or looking into freedom of information requests.